Hey, I'm Brandon, and today I'm gonna be working on the kicking of soccer ball, which contains the flexion and extension, which contains the knee joint, which is a hinge movement. Flexion and extension in the knee is a type of movement where the angle decreases between the articulating bones of a joint, such as bending the knee. Extension occurs when the leg is straightened, increasing the angle between the bones. Some of the important bones including in the knee are the tibia, fibula, femur, and the patella. The fibula is on the lateral side of the leg, while the tibia is on the medial side of the leg, which the femur means that it's one of the biggest bones in the bodies and connects to the hip too. Well, moving on to the muscles, some of the important muscles including are the quadriceps femoris, which include the femoris, the vastus lateralis, vastus medialis, and vastus intermedius. Also, it includes hamstrings and the quadriceps too. The quadriceps femoris group crosses the knee via the patella and acts to extend the leg, while the hamstring muscles flex the knee to extend the hip too. Moving on to the ligaments, there's four important in the knee, which is the medial collateral ligament, lateral collateral ligament, anterior cruciate ligament, posterior cruciate ligament, and including the patella tendon. Some of these ligaments can be exposed to injuries, including the ACL tear, the PCL tear, LCL tear, or the MCL tear too. Sometimes there can be the meniscus tear too. So moving on to the type of injuries, explain how it's possible to get. The first injury is a medial collateral ligament injury, which can be caused by a blow to the outside of the knee or a high energy twisting. Some symptoms can be limited motion, swelling of the medial knee, and tenderness and pain. Treatment can be proactive brace or crutches, or rehab. The next injury is going to be an ACL tear, which can occur from a contact or non-contact causes. Some symptoms can be hearing a pop followed by an effusion, knee buckling, or nausea. Treatments can be splinting, icing, and compressive wrapping. Crutches, reconstructive surgery, and rehab. Another of the injuries can be the posterior cruciate ligament, which can occur during a fall on the extended knee or flexed with the foot plantar or hyperflexion bending too far of the knee. Symptoms can be positive psych test, or treatment can be physical therapy and rehab. There could also be a meniscus tear, which can occur when the knee is twisted suddenly and one or both menisci become trapped between the femur and tibia, or ligaments in and around the knee are torn. Symptoms can be slow and mild knee swelling pain, popping, locking, or giving away of the knee. Treatment can be compressive wrap, crutches, knee supports, activity modification, medication, and physical therapy. Some ways to treat or prevent these injuries can be either one by taping. Some ways to prevent these injuries can be by the MCL or LCL taping, which I will show and demonstrate how to do. And in case of an injury of an athlete, like either a tear or ACL, and they're trying to recover, there's some rehab that they can make. For example, balancing on the injured leg, then switching to the non-injured leg. They could do this over and over for at least 30 seconds. They could start by holding onto something, then letting go, or sometimes even closing their eyes to make the challenge a bit difficult. Another example can be tiptoe walking. They could have someone helping them, tiptoe walk to a line, or sometimes they could do it with their eyes closed too, just to make it difficult. Some other examples can be quad sets, heel slide, or the knee stabilizations. The reason to do these exercises is to help the athlete recover from their injury and help him recover mentally. One way can be by setting goals, which can be very important for an athlete. I would have shown how to done some of these rehabs, but sadly my patient had to go. And well, I'm gonna end the clip of me taping my quote unquote patient, and I'm sorry for the many cuts on my explanations. It was kind of my first time using this, and it was kind of frustrating, but yeah, thanks for watching, and I hope I did great.